Most healthcare meetings are wasting the wisdom in the room. There, I said it. And if you've ever sat in one of those meetings, which I have many times, you know exactly what I mean. People are pulled away from their real work. They sit around a table, listen to updates, hear about a new policy, told what is changing, and asked if there's any questions. And then everyone goes back to work carrying the same level of frustration that they walked in with. That is not a patient-centered meeting. That's some kind of download, and people can feel the difference. A patient-centered meeting, on the other hand, has a real purpose. It connects back to the real care that people are providing. It utilizes the incredible wisdom in the room, and it asks people closest to the work, hey, what are you seeing? It gives staff a real chance to shape what happens next, and it doesn't waste the time of creative and capable people who are trying to keep the system moving. Because ground level people are not pawns. They're not just there to receive instructions. They are carrying critical information that leadership needs. They know where the workflow breaks apart. They know what patients are confused or not happy about. They know which process looks fine on paper, but in real life it falls apart. They know what families keep asking, and they know what staff are creating workarounds for every single day. So if leaders keep running meetings from the top down, they will continue to miss the view from the ground. And the view from the ground is where the truth lives. Imagine if meetings became a place where people left feeling clearer. They felt heard and useful and really connected to the purpose of care. Imagine if meetings helped people feel ownership instead of resentment. And that is it's so possible. But it requires leaders to stop using meetings as control and start using them as an opportunity to listen. If this message speaks to you, Rooted to Rise is available for pre-sale now, and the link's in the bio. And if you're a healthcare executive or senior decision maker who wants to explore what patient-centered leadership could look like inside your organization, message me privately with the word roots, and we can explore whether a private conversation makes sense. And remember, the more power we hold, the more responsibly we must use it. Power is not demonstrated by control, it's demonstrated by how we care for those with less.